Now we come to the oropharynx. In the oropharynx, again you have two folds. Okay, one fold is going from the palate to the tongue. So what would you call that fold here, right here? That is the palatoglossal fold. Okay, and deep to that fold you have a muscle called as your palatoglossal muscle. You have another fold going back, just as you had from the salpinx to the pharynx. You have from the palate to the pharynx a fold which is coming over here. What would you call that fold? That will be the palatopharyngeal fold, and it will contain a muscle. What would be that muscle? Palatopharyngeus muscle. Now in between these two folds here, you're going to get a space or a kind of a depressed area over there. This area, it's like a for someone to sit over there. So who's sitting in that bed? The person sitting in that bed is your tonsils. What you call as, in general, when you say tonsils, it refers to the palatine tonsils, which is this tonsils. Here we saw another tonsils. This was your nasopharyngeal tonsils, which is seen in the nasopharynx. Oral cavity, posterior aspect, oropharyngeal tonsil, you call it the palatine tonsils. The boundaries of the tonsils, what are they? Anteriorly you are going to get a fold which is called as the palatoglossal fold. Behind you have the palatopharyngeal fold, which contain the muscles according to the name. What is seen in the floor or the base, you have the posterior aspect of the tongue. What is seen in the roof, you have the palate there, that is a soft palate. This is not the uvula. This is a uvula would be in the midline there. Okay, maybe it's near the uvula, which is a projection in the middle. So this is a soft palate there. So this are the boundaries of the, what is that fossa called? Tonsillar fossa, because the tonsils are sitting over there. Okay, so even if you get a question about your tonsils, you would have to draw this diagram. If you get about the nasopharynx, again draw this. Everything, anything about the pharynx, about the tongue, anything, it will be good if you are able to draw this diagram and keep this diagram in your mind. Okay, there is a specialty about this palatopharyngeal fold that you see here, or the palatopharyngeal muscle. It has fibers which are going horizontally like this. Okay, and those fibers will form a kind of a ring on the posterior aspect of your pharynx, and that is called as your passivens ridge. Okay, which is also a favorite question of many of the examiners. I do not know why, but because they know that very often the students won't be able to say it, so they get happy. So that is your passivens ridge. It is a fold formed from the muscle fibers which are going horizontally, of which muscle? Palatopharyngeus muscle. And clinically it is also important, which you would have learned in your physiology. You would have learned about the stages of deglutition. In that you would also have learned that when you're going to swallow food, what is going to prevent the food from coming up into the nasal cavity? Sometimes if you talk while you're drinking water, you would see that the water would have suddenly entered into your nasal cavity and you start coughing. Okay, so while you're swallowing, what happens is this area has to get blocked off. Okay, so what happens is the palate rises up, and this passivens ridge also constricts so that this area is blocked off, so that nothing is going to be pushed up into the nasopharynx, because we know nasopharynx, the sole function is for the airway. It's not related to your food. Okay, so that is the importance of your passivens ridge if you are asked about it. You might be also asked about what is meant by oropharyngeal isthmus and what is meant by your, here you have seen concha, but there's another name called as nasal choana. So the nasal choana is the gateway, the opening of the nasal cavity into the nasopharynx, that is somewhere here. How the nasopharynx communicates with the nasal cavity? Through the nasal choana. How the oropharynx communicates with through the oropharyngeal isthmus. It's just a gateway. How the oral cavity is going to get into or continue with the oropharynx. Okay, so those two names can also be asked.